Yeah, today we are with us Dr. Anusha, rheumatologist and immunologist. And this video is specifically for the GPs, general practitioners, when they should consider red flag signs and when they should refer to rheumatologist. Okay. And second thing, everyone understand rheumatologist, more or less GPs understand somehow about what immunologist is.
Okay. So immunology deals with all these autoimmune conditions, like whenever the immune imbalance is there and immunity is attacking our own self. So it is labeled as immunologist. So immunology, it covers all these autoimmune conditions where we have imbalance of this immunity.
Okay. So when should a GPs, example for GPs commonly what happens, somebody get a fever, some people get joint pains for a month. I've seen some people neglect their joint pain even for the 6 months. So it's like somebody, whether it's a post-viral or something. So when is the proper time to refer to rheumatologist for further evaluation?
So usually we see all this post-viral artery, like after a period of fever, viral fever, everyone will have joint pains more or less. So that will be mostly considered as post-viral arteries. But if the joint pains are lasting for more than 6 weeks, and if it has got all the signs of inflammation like swelling, redness in the joint, stiffness in the mornings when you get up after a period of rest, and if it is not getting better with the usual medications what you are treating with, and joint damage is starting up, and then you have a restriction of activities because of these joint pains. Along with this, if you have systemic symptoms like fevers, you always feel feverish from inside, and you always have this tiredness when you get up, and you have this dry mouth, dry eyes, rashes, skin rashes, all these systemic symptoms whenever they are associated with joint pains, it is always better to refer to.
So you see that any joint pain, whether it's a viral, post-viral or something else, if it persists more than 6 weeks, so don't neglect further. You consider rheumatologist for further evaluation. Second thing is commonly to evaluate a joint pains. For example, somebody is having a symptoms of rheumatoid arthritis, as in GPs people will see. So there are multiple tests, RF factor qualitative, RF factor quantitative, and anti-CCP antibodies. So what are the tests you recommend? So the GP should understand that these tests will be done properly.
Yeah.
So that they should not send unnecessary tests.
Yeah. So we have so many tests to detect the inflammation in the body. The basic tests are ESR and CRP. So this is a simple test to detect the inflammation in body wherever it is. It may not be in joints only, but in your body, if you have infection also, if you have inflammation also, ESR and CRP are the first test to raise in your body. And then coming to the genetic test like HLA-B27. So this is a genetic test which is especially advised in case you have this low back pain, which is inflammatory. Inflammatory, as again I told you, if it is associated with stiffness and it is easing with activity, getting, you are having this pain after a period of rest. If you have all these symptoms, you can advise HLA-B27 to see if the patient has got any genetic tendency. The other tests like rheumatoid factor and anti-CCP. Rheumatoid factor will tell about your propensity to develop rheumatoid arthritis. Anti-CCP levels are anti-citrullinated peptide antibodies. These are. So they are more specific for rheumatoid arthritis. So if rheumatoid factor alone is raised, it is not so specific. It can be seen in many other conditions. Rheumatoid factor elevation can be seen after a brief period of viral infection also. It can be seen in urinary tract infections. It can be seen in other connective tissue disorders like Sjogren's, MCTs, mixed connective tissue disorders. It can be seen in lymphomas, it can be seen in hepatitis C, hepatitis B, and all these things. So rheumatoid factor alone is very non-specific. If it is associated with anti-CCP, then it is more in favor of rheumatoid arthritis.
So when you suspect autoimmune conditions,
ANA.
so there are tests called ANA, LSR, ANA, IF, and ANA profile.
Yes.
So what do you recommend?
So ANA IF is an immunofluorescence method where we dye the cells with fluorescent stains and then we see under a microscope. So that is like a screening test. So if you suspect in someone, if the patient is having some hair loss, skin rashes, fevers, and you are really looking for lupus, then you will advise ANA IF first. And then you go for profiling based on the ANA result. So profiling is like you are checking for individual antigens and antibodies in their body, whether they have got any antibodies for the eye, whether any antibodies for the lung, whether any antibodies for the kidneys, joints, all these things you can see in ANA profiling.